This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week on the program, we're visiting with some of the hospital's amazing volunteers. These are folks who offer their time and their compassion, helping patients and staff at KRMC. Why are they called to volunteer, and what does the experience mean to them? We'll hear from some of those folks in a moment. First, a visit with Cecelia Clouser. She's the Director of Volunteer Services. Tell me a little bit about your work in coordinating volunteers.
What I do for the volunteer program for the hospital is coordinate all of the onboarding process for the volunteers and making sure that we have proper staffing of the volunteers in the departments that we volunteer in. And I coordinate with the departments what they need and schedule the volunteers in those departments.
Who is a KRMC volunteer? Tell me a little bit about the people who do this.
They're people who genuinely have the heart of giving and want to give back to Kingman Regional Medical Center for maybe they've had a great experience here, or they're looking for something to occupy their time and makes their heart feel good and happy.
What kind of age range do you have in your volunteers?
It ranges from teenagers starting at 16, and then the majority of the volunteers are retired.
And their careers, do they often have some overlap with the volunteer work they do here, or not necessarily?
Most of the time they're retired, and they're looking to just give back to our community.
Mm-hmm. We'll hear from some of them in a bit, but what do they tell you? What do they gain from the experience of doing this?
They have had a good experience here, so they want to give back, or they're looking to occupy their time and their heart is in the right place and they want to give. And that's why the majority of them are here. Their heart is in the right place.
Yeah. Tell me about the range of volunteer positions here at the hospital.
So we have several different positions within the hospital. We have volunteers that are at the W.L. Nugent Cancer Center. We are responsible for the main information desk when you walk into the hospital. We have volunteers in the gift boutique. They run that entire gift boutique. I'm the buyer, but they are responsible for all the things that happen in the gift boutique. And then we also have volunteers who run the blood drives every quarter. We have volunteers at outpatient surgery, courtesy cart drivers. We have volunteers at the lab, at the Wallapai campus. We have volunteers that volunteer here, and then we also have volunteers at the hospice house.
And my understanding is, specifically with the volunteers, there's an opportunity for them, for example, if they have service learning projects in school, they can coordinate some of that and they can make it part of their school project?
Yes, and they can. So all of the schools require volunteer hours, and so the students will come here. Most of the time they're interested in the medical field in one way or another, and they're looking to gain the experience. We are a teaching hospital, so we will mentor the teenagers. We will help them get jobs here, and then we also offer scholarships for high school students as well.
Do you hear from some of them who are alumni of the program who later go on to work in medicine?
Yes, we see several volunteers around the hospital. We have had a couple people become nurse practitioners as well.
Tell me a little bit about the scholarship opportunities.
We specifically have a scholarship for high school seniors that are interested in the medical field, and then we have an opportunity for other candidates who are pursuing a career in the medical field as well. And we give about $20,000 in scholarships that come from proceeds in the gift boutique, and that equates to about 20 people. If you're a part-time student, it could be up to $750. If you're a full-time student, it could be up to $1,000. The volunteer scholarship is named after Sandra Kofer, a special volunteer who dedicated her life to volunteering here at Kingman Regional Medical Center for over 20 years. She's passed away a couple of years ago, and we honor her by awarding that scholarship in her name every year.
It's such a wonderful investment for the hospital, for the future of this community. I'm thinking about it because I just came from an interview over at Ortho, and I spoke with Kaylee Herrero, who is a physician assistant, and she's from Kingman. And I mentioned to her, I talk with a lot of providers here, and many of them come from far away. And here you are in this opportunity to sort of be a mentor and be a role model for the next generation of providers.
Yes, and it's nice to see the teenagers who are employed here, who we know are pursuing medicine.
Yeah, it's very exciting. How many volunteers does the hospital have at any one time?
We have about 150 volunteers between the main campus and hospice. We're always looking for more volunteers. There's a lot of opportunity here, and there's always a place for everybody. There's cart driving opportunities if that's where you want to be outside, and there's gift boutique opportunities. There's always a place for everybody, and we match up where people want to be and where they want to give to the positions that we have available in the hospital.
Do you have a dream number of volunteers, or you could always use more people?
We could always use more people. Life happens and people age and, medical things happen and people move. So the door is always open for an opportunity to volunteer here.
What is the process of becoming a KRMC volunteer?
So there is an application that's online at azkrmc.com. And then we do an interview, and then you would go through an onboarding process of screening with employee health. And then we do a training and an orientation and match up where you're going to be trained and where your position is going to be. And we have a lot of volunteers who will also cross-train in different areas as well in the hospital. Applications are available at azkrmc.com underneath community. Or you can stop by the gift boutique and pick up a paper application from the main campus. If you're interested in volunteering for hospice, applications are available at the Joan and Diana Hospice House.
Olivia Mangrum, you are the volunteer coordinator and you're the lead nursing assistant over at the Joan and Diana Hospice Home. Tell me a little bit about volunteering for hospice.
Volunteering is a nice way for the person who wants to give to the community, who maybe feels like they need to have a more busy lifestyle. They come to the hospice house. They take care of companion visits with my patients. They also do a lot of paperwork. We do a lot of bereavement programs. They help take care of the bereavement programs. They set the coffee services up. They set the bereavement soup services up. They do paperwork. They bake. We do community work. We do a lot of community work when the community needs, for instance, White Cliffs needs, they're having some special event, they will call us and we will either take refreshments or actually participate in it. So it's a way for my volunteers from 16 to, I have one that's 94, to be able to give to our community.
And what do they get? And they give to the community, but what do they seem to get out of it? What do they tell you?
Well, you know what? When they go, especially to the homes, and they're doing their hourly visits, they come back and say, you know what? It's not about what I gave to them. It's what they give to me. They come back with such insight. They get to listen to all the patient stories, and they just feel like they come back with being a better person.
If I were saying to you, I'm thinking about volunteering, I don't know if I'm right for it, I don't know if I'm going to be a good fit, what would you say to me?
I would say, come on in, make an appointment with me. We will sit. I will let you know what the program has to offer and how you will fit in. We will, whatever you need to do, if you want to go out to see the patients' homes or visit with the patients, you can do that. If you want to stay in the patient or in the Joan and Diana Hospice Home, you can do that as well. You can stay in the kitchen and bake. You can do your paperwork. You can file. We'll find you a place.
I know also that the volunteers serve a vital role. It's actually required under Medicare, Medicaid. Can you mention that?
Yes, we have to have the volunteers. We have to have a program. The volunteers must have 2 hours of continuing education a year. They must attend a monthly in-service meeting every month with me. We take care of all the different education from the nursing aspect of it to the Medicare aspect of it, as well as just having fun.
How many volunteers do you have?
I right now have 36.
Do you have a number in mind?
No, I don't.
Yeah.
I would love to have 50, but you know what? I will take as many as I can get, because they do come and they go. A lot of times they're elderly and things happen, and they can no longer volunteer, or I get young volunteer students that, go away because they're going to school. So I can always use more volunteers.
For someone who's listening and is interested in volunteering at the Joan and Diana Hospice Home, What is the next best step?
The next best step is to go ahead and come and visit me at the Joan and Diana Hospice Home.
Alan, what is your role as a volunteer here at the hospital?
So you can have multiple roles here at the hospital, but mine is cart driving. I drive the golf cart and get people where they need to be because they never are.
And how often do you do that?
I do it twice a week, a morning and an afternoon.
Do you still work a regular job, or are you retired?
No, I'm retired.
And what brought you to KRMC? Why did you decide to volunteer?
Well, I was being wheeled out from having a colonoscopy, and I said, so how do you get pushed in wheelchairs? And they told me to go to the gift shop, and that's what I did.
The career you had, does it inform your work here at all, or is this something just different?
Well, I was a dental technician. We worked with many dentists, probably about 40 of them. So I was sort of in the medical field as it was.
And why do you do this? Why is it important to you?
I find it gives great satisfaction, gets you out of the house and keeps you busy. And all the volunteers are very friendly. So you have like a family that you built here at the hospital.
We heard Cecelia say that she could always use more volunteers, and I have word that you're like the secret weapon of volunteer recruitment. You've brought a lot of volunteers on board, is that right?
Well, the people that I've found mostly have been at the gym, and they're pretty active as it is. And so they do have to be able to walk because you do push wheelchairs or you help people from the cart to where they need to be. So they have to be physically fit. You can't be crawling. Yeah. So you kind of size them up and see if they're giving people. You can't be selfish and do this. You have to give. And you're always helping people. I'm just always surprised.
Yeah.
And it gives you satisfaction. Sometimes it's pretty challenging, but that makes it worth it.
When I come to KRMC, I always see volunteers everywhere working. There's definitely a community there among them. Clearly, they're giving. That's something they have in common. But what's less obvious? What binds those people?
Well, I know they like to help people, and it gives you satisfaction, and people do appreciate it. They're always saying, thank you so much. This just happened to me just a couple of minutes ago. And the staff are very appreciative, too. So you do feel a special glow doing that.
If you're just joining us, this is Focus on Your Health. I'm TG LaFredo, and this week on the program, we're talking with some of the volunteers at Kingman Regional Medical Center. Judy, you're a KRMC volunteer. What is your role here at the hospital?
I work at the front desk. I'm the first person that somebody sees when they walk in. Among people that work with me, there's like 3 or 4 of us at the desk all the time. Uh-huh. Some male, some female. But we seem to serve the people that are asking a lot of questions. They don't know where to go. They don't know where the departments are. And we've got wheelchairs, and some of them kind of confiscate them before we even know it. And we say, where are you going with that? That's why we're here, to escort them.
Well, you work the front desk in a way that makes you the face of the hospital.
From time to time, yeah.
Yeah. Well, why did you choose that particular job? Or did it choose you?
Both.
Yeah.
Yeah. I'm a people person. I'm easy to talk to, and I'm willing to help. Whatever they need, wherever they're going. There was a man that I just wheeled out, and he was parked at the very end of the cement. Well, I'm going to take him to his car because he's right there. Mm-hmm. And one of his legs was dysfunctional. He couldn't move it. So I took the responsibility to hold the door for him because I didn't want it to slam back on his body. And he said, I can drive this car, but I can't drive my truck. So I figured one leg was dysfunctional. Mm. So there's always something about somebody you'll find working in a hospital. Either they need just one more inch of help, or they need a little smile or conversation.
How many days a week are you here?
Just one.
Uh-huh.
I wish I could do more. I'd like to, but I'm in the phase of relocating, I think. Uh-huh. So I'm gone from time to time because I'm checking different areas. Uh-huh. And I'm single. I'm a grandma, and I have 2 grandsons in the military, so I'm a free spirit.
Uh-huh.
So I'm open to other opportunities, like babysitting with the children. I guess they have a daycare here for the employees. I love babies. Uh-huh. But I've but I've really enjoyed being here. In fact, I bake cookies. I'm the cookie grandma, right? So I bake cookies, and I pull out some of my old recipes and try these oldies but goodies, and they never turn them down, so.
It's working.
Yeah,
You said you're a people person.
I am.
What do you get out of serving here?
when I go home, if I've been busy, and Monday's usually a busy day, I'm tired, but it's always satisfying. You know, it's very satisfying to help somebody that needs help.
That is Judy. She is a KRMC volunteer. You can probably catch her at the front desk, and she made a point of saying that she's single. I'm just mentioning that.
And she's vegan.
And she makes great cookies. So
That's what I was just eating. Did you see me? I was eating one of her.
A 5-layered cookie.
Yeah, so good.
If nothing else, come for a cookie.
I'm so glad you were here today.
What, is it okay?
it's fantastic.
Okay.
Thank you so much, Judy.
Thank you.
It was a pleasure. Thank you.
so much.
Oh, sure.
Michael Fulham, you are a KRMC volunteer. You also have a history in radio, so I think you've been itching to do some talking. Let's hear that presenter voice.
The presenter voice, it's just the same as my regular voice, isn't it? I always sound the same.
But I want to ask, what is your history in radio?
I worked radio as a disc jockey initially, and then moved on to news, and then moved from radio news to television news, ultimately, before coming to Kingman and finding my current calling at Kingman Regional Medical Center.
And how long have you volunteered here at KRMC?
8 years.
What do you get out of it, Michael?
So much satisfaction all the time. People say, tell me stories, but I also work at the information desk at one of the other campuses, and people come in and they ask me information, and then later on they come back and they say, thank you, appreciate the assistance and all that. And it just really feels good when you know that you just helped somebody's day.
We've talked about how there is a range of positions for volunteers at KRMC. The one that I think is dearest to you is that you coordinate blood drives. Is that right?
That is correct.
Can you tell me about that work?
Well, KRMC Volunteer Services hosts quarterly blood drives at the main campus, and we also now are hosting blood drives at our other campus on the months that we're free. So we're doing 12 days of blood drives every year.
Help listeners get the sense of the importance of blood drives, the need for that in the community.
About 1 in 7 people who come to the hospital, and people really need to wrap their head around this because it's very important. About 1 in 7 people need blood. We're talking about accident victims, surgery patients, cancer patients, even pediatric patients. And at Kingman Regional Medical Center, as with any hospital, our blood supply comes from the people who have donated it. It's not something you can make in a lab. If someone needs a transfusion, it comes from the blood that's already been donated. And so when you give blood, you give someone another chance at life.
When you talk about the drives, do you have a target of how much blood you hope to get for each time?
Our blood bank actually gives us goals for each of the drives that we do. Currently, our goal is to register 116 people on each of the days. It changes from time to time. It'll increase. There's a really big blood shortage right now. So we're really hoping that at least that many people will come in and register. Occasionally people are deferred for various reasons. Their blood pressure may be too high or their iron level too low. And people might be on certain medications which might excuse them from donating. But we just want people to present themselves and to give. KRMC does not purchase blood or blood plasma or any blood products from individuals. This is a donation thing. It's one of the best gifts, though, that you can give. It's just so incredible.
What is the best way for the community to keep up with the dates and times and locations for upcoming blood drives?
All of our blood drive information is on our website at azkrmc.com under the community tab. You can also, we have a special place where folks who are interested can go and actually make an appointment, and that's at vitalent.org/KRMC.
Vitalent.org/KRMC. Michael, you've done this before.
I have indeed.
You said you have volunteered here for 8 years. What do you get from this experience?
It's just really a wonderful feeling of community, of doing something with other people. Cecelia is so wonderful in saying that, acknowledging what I do for the blood drives, but it's not the Michael Fulham blood drive. It's not, I'm just a tool in making this happen. It's all of us together. On the day of the drive, there are about 4 volunteers who come and help register the donors and sit with me in the location where the blood drive is taking place. And together, a number of our volunteers regularly donate blood. It's an effort by all of us. So it's for the blood drives, it's just so wonderful knowing that you make a difference. People tell me stories. We have so many regular donors that come and donate every single drive, and they'll tell me stories about what made them come and start doing it.
That's beautiful. Is there anything else I should ask you?
I'm single too. No.
Cecelia, you have been sitting here with me listening to testimonials from your volunteers, and you said, oh my gosh, I need to say more about these people.
Yes. The volunteers here are amazing, incredible. I've already said that they come because their heart's in it, but the friendships that have been established here, the bond that we have together, we really are a family, and I can't give them enough credit for being here and the impact that they make on the departments in the hospital, but we do hear it. The lab constantly is telling me how much they appreciate the volunteers, and if you've ever been to the lab at the hospital, you will know how busy they are, seeing on average, I think, 225 patients in there, and we really make a difference here, and I'm proud to be a part of all the wonderful things that the volunteers do. We were just awarded the Andy Devine Organization of the Year, and that says something about our volunteers. It feels good to be a volunteer here at Kingman Regional Medical Center, and I'm proud to be a part of all the things that we do for the hospital.
Well, speaking of awards, all your volunteers are special and they're all contributing, but you also have something special to recognize them.
Yes, every month we have a Volunteer of the Month, and then in April it's National Volunteer Appreciation Month, so we also award a Volunteer of the Year as well. And you just can't say thank you enough to them. And I want to do everything I can to make sure that they feel special, because they are so special to our hospital, and saying thank you just doesn't feel like it's enough.
Big thanks this week to Cecelia Clouser and all of the volunteers at Kingman Regional Medical Center. If you are interested in this opportunity to make a difference in your community, become a KRMC volunteer. You'll find an application on our website. Visit azkrmc.com and look under Community, or just stop by the Gift Boutique at the main hospital campus. And that is the program. That's Focus on Your Health. I'm TG LaFredo, and thank you for listening. We'll catch you next time.